Upstairs.
Yours is working downstairs. Hi, Tammy.
Good morning.
How are you?
Thank you.
Good. Sorry, I missed your call. I was in another meeting. I am back to back today. So,
I understand. You got the email, so that's what matters. Just
yeah.
always want to try to be conscious of my timing. And
Yeah, I think
I
when
thought we had said I had the full hour, but then I didn't have it in my notes, so I just wanted to confirm.
yeah, my Wi-Fi is giving me all sorts of issues today, and now is not the time to have that occur. Um,
No.
yeah, I don't know what's going on. Like internet instability and all sorts of things occurring, and I don't know why. But I think we're back up.
Always seems to happen at the worst time, doesn't it?
It does. So I am on my hotspot from my phone, so fingers crossed. Oh, you don't mind if this is recorded, correct?
Nope, that's fine.
Okay, perfect. All right. Looks like we had quite a few people registered too, so it looks like we'll have a
Oh, good.
good number of people on. And by good number, I usually mean like 20 some people, because
Oh,
our our group knows that if they miss it, that it's recorded, and so they'll come back and watch it later. So we always go back to see like, well, how many people have watched the video since we've posted it?
sure. Oh, that makes sense. I appreciate the clarification, yes, because a good number for some groups is 100, right?
Yeah, yeah, yeah. Well, we only have 35 critical access hospitals, so
Well, that's true, right?
so that's half of our attendance right there. So
And should I just share my screen or share my slides
yeah, go
now?
ahead. Yeah, whenever you're ready, I
Okay.
just give you access. So yeah, whenever you're ready. I just like to jump on a few minutes early to give you the opportunity to get yourself set up, because I know for me, I will look at my slides and I'm like, is that the right slide? Is that? But right now I see your entire slide deck, like with the notes and
Yes, I'm trying to get into the
everything.
view. There we go. Okay. And that's all you're seeing now is the full
Yeah.
screen, correct?
Yep. Yep.
Oh, and I can come on camera too.
Yeah. So I want to send you, so while we have a couple minutes before people join, the Michigan Center for Rural Health is applying for a grant through the Michigan Health Endowment Fund's Healthy Aging Grant. And
Hmm.
we are looking to implement geriatric emergency departments in a few of our critical access hospitals across the state. I would love to get your eyes on the concept paper, just to see if there's any alignment with what you've got going on there at the state office, and just kind of looking at like, oh yeah, that aligns with some of the things that we're doing. Because I think that would be just for like, you know, collaborating and coming together, and we're being intentional about doing that. Wanted
Yes.
to send that over. So just giving you a little bit of context that that's going to be coming your way. Um,
Sure.
just for you to, just as an FYI, to know what we're doing here, and seeing if there's any alignment.
Yeah, that sounds good. We still have, it looks like a couple minutes. I'm going to go off camera.
Yep.
I'm in a different room because I'm in cubicle land, so I reserved a
Okay.
conference room, but I left something at my desk, so I'm going to be
Okay.
right
Yep. No,
back.
you're perfect. Thank you.
And I think are you recording now or that? I
No,
think
no,
you
no,
are.
no,
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 okay, good.
not yet.
Okay, then be right back.
Yep.
Amanda, FYI, I am showing that we are recording already.
Okay, it's not on my side, but maybe. Oh, it does. Okay, we'll just cut off anything we need to cut out prior to starting. Thank you for letting me
All
know.
right.
Must
You're
be it got
welcome.
set up to record immediately because normally we don't do that. So yes, thank you for letting me know that. And I don't have to
Sure.
push record, but we'll need to cut some stuff out.
Yes, exactly. The chit chat.
Yes, the chit chat. All right. We'll give it just one more minute to let people join and then we can get started. All right. Well, I want to thank everyone for joining us this afternoon. We have with us this afternoon Tammy Lemmer. Tammy is the State Assistant Administrator for the Bureau of Aging, Community Living, and Supports through the Michigan Department of Health and Human Services. Tammy, I will turn this session over to you. Just as a reminder, we're recording this morning or this afternoon. So if we could put ourselves on mute and then feel free to put questions within the chat. Ask Tammy. I'm sure she'll be taking questions throughout as well, how she's going to be leading today's session. We will let Tammy get started. Thank you, Tammy.
Yeah, thank you very much. It's a pleasure to be here. And as Amanda said, I'm with the Bureau of Aging, Community Living, and Supports within the Department of Health and Human Services. And we perform the functions of the State Unit on Aging. So this is a little bit of information about our history. We originally, the Office on Services to the Aging, actually back we were founded in the early 70s. That's actually when the Older Americans Act, the federal legislation, was developed that created the Aging Network. And I'll talk a little bit about the Aging Network, who we are, what we do. But we've had some evolution over the years in terms of where we sit in state government, but we are within the Department of Health and Human Services following a merger back in March of 2022. Our bureau not only serves as the state unit or performs the functions of the State Unit on Aging, which basically involves overseeing the Older Americans Act programs and services. And in Michigan, we actually have state legislation called the Older Michiganians Act. But our bureau also manages Medicaid-funded home and community-based services, and I'll talk a little bit about what that means as well as the Long-Term Care Ombudsman Program, which is sort of a residents' rights and advocacy entity for individuals living in specific licensed long-term care settings. So very briefly, just to give folks a quick overview of our bureau, in addition to the OAA, as I'll use that abbreviation, but if I use abbreviations throughout and no one knows what I'm talking about, just call me on that. I also welcome questions throughout. Amanda or others, if people want to raise their hands, or you can just come off mute and interrupt me, I'm also okay with that because I can sometimes just keep talking. I get very passionate about these programs and services. I've been in the Aging Network for about 10 years now, and I've spent most of my professional career in the nonprofit sector, social services sector. So I get very passionate about programs and services that serve this population. But in addition to the OAA services, as I mentioned, we have Medicaid funded programs, including the Home Help Program, My Choice Waiver, the PACE program, or Program of All-Inclusive Care for the Elderly, and the My Coordinated Health Program, which is previously known as My Health Link, which was a demonstration project that is moving statewide. I don't have a lot, or I haven't built in a lot of time to talk about these specific programs, but if I'm very happy to answer questions or provide information for you about any of those Medicaid funded programs. I want to focus primarily today on our role as the State Unit on Aging, which are for individuals. The OAA spells out an older adult as someone who's age 60 and older. There's a couple exceptions to that. For example, a kinship care provider, someone who is an older adult providing care to often a minor child, but often a grandchild, maybe a niece or a nephew. There are kinship care services available for those age 55 and older. And then caregiver supports are a really important part of the Older Americans Act as well. So someone who is providing care, typically unpaid, maybe family or friend caregiving support for that older adult, age 60 and older, that caregiver can be of any age. So again, I want to focus primarily on those OAA programs and services and the role of the State Unit on Aging. One fact that I do try to reiterate whenever I'm talking to different audiences is that unlike the Medicaid programs, which have, by definition, a Medicaid financial eligibility threshold, there's a financial need basis to your eligibility. For the Older Americans Act programs and services, there is no needs-based criteria, or financial needs-based criteria, I should say. In other words, there's no income eligibility threshold that needs to be met. It is all focused on age and the needs of the individual who's seeking that support. But I understand there's been some interest in the state plan on aging. So as the federally designated state unit on aging, we are required by the federal government to produce a multi-year plan. We have the option of doing a 3, 4, or 5-year plan. Here in Michigan, ours is a 3-year plan. And so right now in fiscal year 2026, we are in the 3rd year of our current plan and are undergoing the development process for our next state plan on aging, which will be in effect as of October 1st of 2026, which will include fiscal years 27, 28, and 29. And as this slide indicates, the plan is really a blueprint for what we as the State Unit on Aging are going to do. How do we conduct ourselves? What are our priorities? We are asked to develop goals and objectives. And it's all related to how are we functioning under the Older Americans Act rules and regulations. Another element of the plan is we actually have to define our process for distributing the funds that are received, whether they're state dollars through Older Michiganians Act or federal dollars under the OAA. So we have something called an intrastate funding formula, and that is something that designates different categories. So, for example, we have very large geographic regions, such as the Upper Peninsula. We have very tiny geographic regions. So, for example, Kalamazoo County has its own program service area. City of Detroit and a few of the suburbs is another program service area. But each of those, again, regardless of their geographic size, their populations are different. So we have factors that relate to number of individuals age 60 and older, number of individuals age 85 and older, which is important, as you'll see in a future slide, as well as square footage and some other factors. So that, again, we're trying to distribute the funds where they're going to be most needed and most equitably allocated to our region of AAAs, Area Agencies on Aging, which I'll talk about in a minute. So for our plan, again, our requirements by the federal government, the abbreviation ACL there is Administration for Community Living. We're asked to develop or conduct a needs assessment. And then from those needs, we determine specific goals, objectives, and strategies. We are required to go out to public comment for our plan. So it's not something that's just done, here in the quote unquote ivory tower, making it, a document that we think is going to be appropriate. We share it out with different stakeholders. And then there's a narrative and then a number of different attachments that are required that provide some supplemental information. We'll have a draft. Some of this is a little bit in the weeds for you, but we'll have a draft that'll go to the feds by June 1st. We do here in Michigan have something called the Commission on Services to the Aging. I apologize for that abbreviation being there, CSA. That is a governor-appointed body. It's 15 individuals that represent, they come from across the state of Michigan. And they basically are sort of our governance body. They approve budgets, they approve operating standards, otherwise known as our policies and procedures for the AAAs and the Aging Network Services. And they also serve as an advocacy body for older adult and caregivers across the state of Michigan. So they have formal approval authority for our state plan. And then once that is approved, it will go into the feds. And in the plan, we are required to provide some context, some background, some information about the state of Michigan. And so part of that includes demographics. What does the state of Michigan look like in terms of our older adult population? And we are considered by different metrics, approximately the 13th oldest state in the nation in terms of our older adult population. And that continues to grow. Every year, we have, if you're probably familiar with the baby boomer population, it was a big bubble of babies post World War II. And those individuals have continued to age, which is wonderful. Our longevity in this country has continued to expand. Little blip during COVID, unfortunately, but that seems to have kind of corrected itself, and so we're back on track for continued improvement in longevity for individuals in the U.S. And so you can see the projected population growth, especially at those higher age levels, 70, 75, 80, 85 plus. We're going to be seeing up to 60% increases in those demographics over the next 10 to 15 years. Some other context that we provide as it relates to the state plan, we do talk about our aging network and the 16 area agencies on aging that provide those OAA programs and services. We have 12 sovereign tribal nations here in Michigan. That have their own, of course, tribal governments. They have, in some cases, health clinics, health care. And in some cases, they also receive direct funding under the Older Americans Act. It's a title of the OAA called Title VI. And Title VI allows for the federally recognized tribes to apply for individually grants or to combine and have a fiduciary to serve specifically their tribal elders. And so that's important information that we need to document in our state plan, kind of not only what those numbers are, what those realities are, but we're also required to talk a little bit about our relationship with those tribes and those Title VI grantees. So what you're probably a little more interested in rather than the sort of the nitty-gritty on the plan development is our needs assessment. We conducted over the late fall of this past year. We had 29 key informant interviews, 26 community conversations, and received over 4,000 individual surveys that were submitted by older adults, again, those age 60 and older, as well as caregivers of that population. The community conversations were held across the state. They were all in person with the exception of one, which was held virtually. And those were something that I went out to. We had different locations. They included senior centers. They included community centers. We had a Michigan Works facility that hosted us. We were in a church, wide variety to some community-based organizations. The goal was to reach as many different communities as possible. Couldn't feasibly or logistically reach all 83 counties in the state, but we were very committed to trying to make sure that we were at least in each of the 16 AAA regions. And those were, again, we call them community conversations, listening sessions, town halls. It was that type of a concept where we had some set questions that we were asking of the participants, but we really wanted to hear from them. What are your experiences? What do you see? What are your needs as an older adult? we were also asking information about how do you access resources? How do you find out about information that you might need as you age or as your loved ones age? And similarly, the key informant interviews, we talked to basically key stakeholders, people in different settings and sectors, um, included representatives from the Health and Hospital Association. We had individuals from the disability sector. We had individuals from housing, because as you'll see in a moment, housing is a huge issue for our older adults, and it is something that we face some challenges in terms of what's the scope and the responsibility of the State Unit on Aging. But we talk a lot about helping individuals age in place. That's our goal. We want people to stay living independently in their homes and communities for as long as possible by making these in-home supports available to them. And a phrase I picked up at a gathering once is, if we're going to age in place, we need a place to age. So again, housing is an important theme that we hear a lot about for our older adults. In addition to this data gathering, we also reviewed existing plans. We reviewed plans, for example, through the Developmental Disabilities Council, which also has a 5-year plan that they are required to submit to the federal government. There's a state plan for independent living, which again tends to focus more on individuals of all ages with disabilities, but there's obvious intersections with older adults and adults with disabilities. We also worked very closely with our area agencies on aging because they too are required to conduct needs assessments. They too develop what we call multi-year plans, which is a more localized version, helping them understand the unique needs and potential barriers of older adults and caregivers in their communities. And so partnering with them, reviewing their current plans, reviewing other documents, in some cases, the community health surveys, the different health and wellness plans that exist at the regional level. Those data sources were all really important in the development of our plan. So just really quickly, kind of a point of pride for us, and hopefully you can see the key at the top. We were successful in receiving surveys from literally every county in the state, and so we were really proud of that. The dots on the screen reflect where we held community conversations. So you'll see, again, we didn't hit every county, but we did try to hit as many as possible. We were up in the UP at 4 different locations, including 2 tribal partnerships or tribal locations, which was a wonderful opportunity for us. You can also see where some of the surveys kind of reflect where we were physically. There was maybe perhaps more attention drawn to the needs assessment. We were able to talk about the opportunity to provide feedback not only during the community conversations, but also via the survey. So you can see, again, there's some correlation with where we were physically in person and where we received surveys. But again, we were really pleased to receive input literally from every county in the state. So key themes, key topics. What did we hear? What did we learn? Not all of it was new. Some of it reiterated some of what we knew anecdotally. Some of it is very similar to what we've seen in past needs assessments. But the one that was very prominent, again, this was across all the different the categories, whether it was a community conversation, an interview, or a survey, but access and affordability of healthcare services rose to the top in a way that I'm not sure we've actually seen in past needs assessments. Now, granted, this was during Medicare enrollment period. So for those of you who are familiar with Medicare, you may know that some of the Medicare Advantage plans were withdrawn in the state of Michigan. So some of that coverage, folks were seeing very significant changes in what was available to them. And just again, changes, fear related to the tax credits and the Affordable Care Act changes, all of the changes or potential changes for Medicaid funded healthcare as a result of HR1 at the federal level. So it was very top of mind for many of our needs assessment participants, and that came through loud and clear. Caregiver supports is another, not a new issue for us, but something that we recognize is something that's really important. We in Michigan talk about caregiving in a couple different ways. We have, as I mentioned, that family support, the informal, unpaid caregivers. And we also have a very vibrant direct care workforce. So, or in some settings, they're called direct support professionals. Those are individuals that are literally in the homes, or in some cases, they might be in a skilled residential setting that are providing the care, the support. It might be indirectly related to health supports, medication, support for medication, but it might also be activities of daily living, the just chore services, home repair. We need a strong, vibrant workforce to bring those services to those individuals. So we heard a lot about, again, both paid and unpaid caregiving and direct care supports. Information sharing, of course, is always another important theme. We always hear that people don't necessarily know where to go or who to ask or what to ask as they're aging or as their loved ones are aging. And, we ask a lot about, well, where do you turn? How do you find out about information? And there's a lot of word of mouth, but there's also, we heard overwhelmingly that people turn to their healthcare providers. Especially if it's a point of crisis, maybe there's been a healthcare concern, a health status change, maybe there's been a fall, maybe there's been an illness. And whether someone is directed to rehabilitation as a next step following discharge, or maybe they're discharged at home, but their reality is going to be a little bit different following that hospitalization. There's a lack of information and knowledge about what supports are truly available. So I really appreciate the opportunity to talk with all of you today, because the information sharing, again, not only within personal networks, but across systems, is something that's really, really important. It's something that we're going to be really focused on here at the State Unit on Aging. We are now, but are going to continue to be helping to build the professional networks, those collaborations, the partnerships, et cetera, so that the folks you're seeing in those healthcare settings have better or increased access to the information and knowledge that would be helpful to them to help them, again, stay healthy, safe, and independent in their homes. Speaking of housing and being safe at home, safe, affordable, and accessible housing and transportation were, again, huge themes that we heard. And housing is not just, I need a roof over my head, but I need to be able to stay in the home, or many people want to stay in the home where they're currently living, or maybe where they've raised a family. And as our mobility changes or our health status changes, sometimes that isn't always possible. But it can be made possible through home repair, through adaptations, through modifications. It might be ramps, it might be grab bars to make the bathroom settings a little more safe and accessible. And sometimes I mentioned those chore services or the chore support. Sometimes just things that many of us, if we're able-bodied, may take for granted, but being able to shovel the snow off of our sidewalks, or being able to mow the lawn so that we're in compliance with the local township ordinances that tell you your grass can't be higher than X number of inches. Those are things that impact a person's ability to stay living in their home. And there are funds available through the Older Americans Act. They're very nominal in the scheme of things. I mentioned this is not a financial needs-based program. But it's also not as robustly funded as the Medicaid programs are. And so that's a theme we hear in our advocacy a lot, or the advocacy world, is trying to make sure that those funds are distributed and made available to help people regardless of their income and eligibility, financial eligibility for other programs. And then again, the last item, oh, wait a minute, and transportation. Transportation again is also a need. I'm sure it's not a new need for all of you. Transportation to healthcare services, which relates to that first bullet. Um, how do I get to my doctor's offices? How do I get to the pharmacy to pick up my prescriptions? Excuse me. But also, how do we get to some of the fun things in life? Being able to stay socially engaged is an important part of healthy aging. So, how do folks get out to see their friends, to see their family, to attend community events, maybe to go visit a local senior center or community center or local gym, etc., a concert, an art fair, etc. So those are things, again, many of us take for granted. As we age, there may be different reasons why we are no longer able to or no longer choose to drive, or maybe driving was something that was never an option for you in the first place. But the availability and the affordability and the accessibility of transportation continues to be a huge theme for our older adults. Oops, what did I just do? Sorry about that. The screen sharing has paused. I don't know how to unpause it. So I'm going to start over. Okay. Are we
Good?
back?
Yep, you're good.
Okay. Thank you. I must have hit a button. Technology and I don't always get along. Um, okay, there we go. So, let me pause there before. So that was the very high level needs assessment information, our themes, our trends. Any questions about those? Anything that you find surprising, or maybe things that aren't surprising? I don't see hands up. Well, what I didn't put on the screen that I'm happy to share with you is, what did we do with those themes and those trends? What I can share is the goals that we came up with, and goals for us are sort of those larger, more aspirational. Some might call them more vision statement level of information, but let me share with you our proposed goals. Enhance access to services for older adults and caregivers to support their health, independence, and social connectedness. Um, that's a reflection, although I didn't include it on this slide, the concept of stigma, the concept of sort of not always, even the systems we work with, not always acknowledging, embracing, and supporting that independence, that dignity for our older adults. We really wanted to zero in on, and you'll hear that in a different goal as well. But we want to make sure that our folks have access to the supports that are needed to help them stay safe, stay independent, and stay socially connected. So we want to take advantage of existing programs, different initiatives across the state. Some are state-oriented programs, and some might be more local or regional. So we want to do our best to, again, help connect folks with what's available, and if it's not available, what kind of partnerships or collaborations might we be able to explore. That leads to our second goal, which is promoting collaborations and partnerships. And that's something we want to do across MDHHS, which is a large entity in and of itself, but other state departments, our AAAs, our tribal grantees, other agencies and partners. And we have our third goal, which is to enhance pathways for accessing information so that older adults and their support network are aware of resources. So again, that speaks to that information sharing, that need for continued education, awareness raising, but also tying in with that partnership and collaboration, knowing where seniors are connecting with other supports and helping to promote and expand the knowledge and awareness of these home and community-based services so that there's, again, better access to and better knowledge of the resources that are available. And then finally, our fourth goal is actually kind of a unique one, utilizing language and messaging that celebrates aging and communicates the strength and value of our older adults and those who provide care. So again, that might ties in a little more again with that concept of stigma. We hear a lot about to prove their independence, and many of us are guilty of this too, right? We don't want to always admit that we need help, or we don't want to acknowledge that we might be struggling in ways that might be new to us. So we want to kind of shift that narrative and again celebrate aging. Being an older adult is a privilege that not everybody gets to earn, right? And so how do we promote and celebrate that? And by doing that, letting folks know that these services are available to you specifically because you are an older adult. Again, you've earned the right to access these services and support. So we want to make sure that you're aware of them, know how to access them, and can get those services you've earned. All right. My computer, there we go. Again, me and technology. So I do want to shift a little bit and highlight a few, again, of the specific home and community-based services, talk a little bit more about Older Americans Act programs and services specifically. Some you may be familiar with and others might be newer to you. And I've kind of alluded to some as we've gone along. And I'll point out that on the screen is the map of our 16 AAAs, Area Agencies on Aging. And you can see again both the geographic breadth and diversity, as well as you can imagine, some of our communities are very, very rural, some are urban, some are mixed, some have all three categorizations. We have, in terms of the demographics, if folks are interested, some of the oldest counties in the state are in the Upper Peninsula. And then conversely, geographically, the largest percentage or sort of concentration of older adults is in that Southeast Michigan, sort of the 1B, all of our AAAs have numbers. They're numbered by region. Some have what we call real names, and some are just literally Region 4, Area Agency on Aging. But that band that's labeled 1B happens to be our largest concentration of older adults. Some of that is just by nature of that is a highly populated portion of the state. So the AAAs are, again, statutorily under the Older Americans Act required to focus on specific core services. Those include access to services, nutrition, home and community-based services, disease prevention, health promotion, vulnerable elder rights protection, and caregiver supports. So just to highlight a couple of these, access to services, for example, that's basic information and assistance. Our AAAs we sort of position ourselves, and I use the our terminology because I used to work at a AAA. We like to position ourselves and feel that we are experts in aging and that we are an important stop in your journey towards aging and your connection to supports and services. So some of our AAAs have very robust INA or INR, information assistance, information referral programs, and that they often are sort of that key entry point. And we want to make sure that you as healthcare providers are aware of who the AAAs are in your community so that you know that you can make those referrals. You can call on behalf of a patient or at a minimum provide contact information about your local area agency on aging to that patient. Nutrition services, many of you are probably familiar with home delivered meals, aka Meals on Wheels. That is something that's an OAA service. It's also a Medicaid funded program under some of our waiver programs. But again, for the OAA programs, it's not a needs-based program. A lot of people think Meals on Wheels is specifically for low-income individuals, and it is not. There is a needs-based assessment, but individuals might have difficulty preparing their own meals due to, again, maybe physical limitations, maybe memory, cognitive issues. Maybe they don't have access to healthy food, aren't able to get out to the grocery store to get those healthy foods to prepare those meals. So a lot of different reasons why someone would be assessed as quote unquote nutritionally at risk. For folks who do have a little more ability to get out and about in the community, you may have heard of congregate meals or senior dining sites. Those are locations in the community, often at senior centers, but not always. Some are church-based, some are at different local nonprofit organizations might be a host site for that dining site, and that's for individuals again age 60 and older, or their spouses are eligible to attend and get not only that healthy, nutritious meal, but some socialization, some programming, some nutrition education. So it's meant to be a kind of an all-encompassing, both nutritional opportunity, but social engagement opportunity as well. I've talked a little bit already about the home and community-based services, and really that's focused on what are those activities of daily living that we might need help and support for. It might be with bathing, with grooming, might be actually just getting up and out of bed in the morning. Once I'm up and at 'em, I'm good to go, but I might struggle a little bit, maybe first thing in the morning or at the end of the day. You might be particularly interested in our disease prevention health promotion. We have a number of evidence-based programs that our AAAs provide. A lot of it is related to chronic disease self-management. We have diabetes-focused programs. We have general nutrition education. There are some specialized, there's fall prevention programming that the AAAs offer. Also education, just general health and wellness information and supports. These are typically multi-session workshops that, again, they're held out in the community at community-based locations. During COVID, some of those shifted to online, so some of the regions might still be offering virtual workshops, but most have actually reverted back to an in-person because there's a sense of community, a sense of, again, you get that social engagement if you're out and about and actually connecting with others who are maybe in the same circumstances that you have. Some of those evidence-based programs include caregiver supports as well, caregiver workshops that might include just general caregiving for someone who might be experiencing a chronic disease or changes in their status, but it might also be something specific. For example, dementia-based caregiving is a little more unique. Being able to navigate the changes of that disease, the changes both physically and sometimes cognitively and emotionally and behaviorally for someone who's experiencing dementia can be a little more unique. So we have some very specialized workshops for those caregivers. And then caregiver supports might also include respite care, something that's it's a targeted, structured break for that caregiver. So it might be in the form of an adult day program, or it might be in the form of some other supports, so that that caregiver does have that opportunity to take care of themselves in an effective, efficient way. That we talk about in caregiving circles, the concept of, if you've been in an airplane, the air mask, and the flight attendants always talk about, make sure you put your own mask on first before you help someone else. Because if you're not in a position to take care of yourself and you are then a little more vulnerable, then you're not going to be in a position to help anybody else anyway. So that's a theme that we try to share with our caregiver support programming as well. And then I skipped over elder rights protection. That might actually be formal legal support. Sometimes it's support for tenancy issues, housing, maybe eviction prevention. It can also be help with if you've been a victim of a crime. It might be to help with documents, legal issues that you might be facing. So it's a wide spectrum of what might be available. And then I mentioned also the long-term care ombudsman falls under the elder rights protection as well. And that I'll just point out again that the 4ami.org is the website for the Area Agencies on Aging Association of Michigan, hence the 4As. And you can actually, they have a searchable link on their website where you can look up by county which area agency on aging is going to be serving your community. Other AAA programs and supports, I've referenced combating social isolation. Sometimes that includes some volunteer opportunities that are organized or structured by the AAA or some of their partner organizations. Many have what we call friendly reassurance. So these might be staff or volunteers who literally pick up the phone and check in on a regular basis with that older adult. Many of these individuals, and that's actually a benefit of the home delivered meals program as well. Many of these individuals, they might be living alone. And may not have regular contact with others, and so that delivery of the meal is more than just a meal, we kind of say, and also just even having that voice on the other end of the line, just to have that engagement, to have someone else to talk to, which can be just a benefit on the surface, and it can also lead to in conversation if there's any red flags that are raised, if there are any concerns that volunteer or that staff member can hear about, they can help maybe connect them with supports or services. Transportation assistance, again, there are funds, very limited funds in many cases, that can help with more of that door-to-door support for an individual. We hear a lot about that. So even when in communities where there is public transportation available, it isn't, in some circles, you might hear that last mile concept or the first mile concept. So it's fine to have a bus stop, but if the bus stop is, even as far away as a block away, in many cases it might be further than that, that distance might be a barrier. So we're often asked for more of that door-to-door support. I mentioned information and assistance, referrals, and then gap filling is actually just what it says. It's really meant to say, okay, there might be unique needs for this individual. There might be something that is going to help them stay independent, help them stay safe and healthy. So what can we do? Sometimes that's financial assistance in the form of helping to cover the cost of the medication. Maybe there's a prescription that was not anticipated or expected, or utility costs, which can continue to rise. And for our older adults who might be on a fixed income, their income's not changing, even if that gas bill or that electric bill is going up. So there are some funds available. There are also some funds occasionally for home repair, home modification, the things that I mentioned before. Someone who might need a ramp, might need a grab bar, etc. But sometimes people might need a new roof, or they might need their plumbing repaired or replaced, or there are other safety issues in that home that might be a barrier for that person to stay living independently. So the AAAs do have flexibility when funding allows to help with, again, what we call that gap filling. I do want to highlight, some of you may be familiar with this because it's been up for about six-ish to nine-ish months now. Other states, if you've heard the term no wrong door, it's really meant to be that concept of there's one point. It doesn't matter if you know about a AAA. It doesn't matter if you maybe aren't 60 yet, and so you don't think a AAA is going to be the point of contact for you. Or maybe it's a service that's provided by a Center for Independent Living, which is really more focused on individuals with disabilities. We have created our Michigan's No Wrong Door system, and we call it My Options. Of course, that play on the MI. Everything in Michigan is my something. And it is a free statewide toll-free number that will connect someone with some basic information, right? Again, maybe my situation has changed, my health is declining, or I'm looking for a change. Maybe I'm trying to be proactive, which we highly encourage, in terms of like, as I age, do I want to stay in my current home or do I want to look at other places? What supports and assistance might I need if my health changes or my mobility changes? So we have this system where you can call this number, or you can actually go to the website for some basic information. The website's actually being developed and it'll be much more comprehensive soon. But it's a one number, and you can call and you can say, this is the kind of information I need. It is available for people who are looking for long-term supports and services assistance. They might not know that term, but they know I'm getting older and I want to be able to stay healthy and independent. Or they might think their only alternative is maybe a skilled nursing, aka a nursing home. They might not even be familiar with the concept of home and community-based services. So this number is that entry point, that again, that no wrong door of I can call this number, I can ask some basic questions. And if I'm interested, I can be connected to a counselor in my community or in the location of my choice who can sit down with me and have that more comprehensive conversation about what are my circumstances, what are my needs, what am I facing now, what do I anticipate I might be facing later. It could be a family member who calls, and we certainly, in being person-centered, using the language of the program, person-centered options counseling, we want to make sure the primary individual is engaged and involved in that conversation. But we understand caregivers, family members, et cetera, may want to be helping with that process or may want to become informed on their own account. And we also have incorporated under the same toll-free number our State Health Insurance Assistance Program, or SHIP, if you're familiar with that. It used to, in Michigan, be called the Michigan Medicare Assistance Program, or MAP. Federally, it has always been called SHIP, and so we've just sort of readopted the SHIP name and brought that again under the umbrella of the My Options. Because if someone is looking for long-term supports and services, they very likely are eligible or soon to be eligible for Medicare, and vice versa. If someone's looking for Medicare assistance and support navigation, they might be someone who could benefit from information about long-term supports and services. So we're excited to have this number. We hope it's a number that is something that becomes familiar to you. We have flyers that we can make available if you're interested, or again, just knowing the website, you can always search that page for the phone number or information, because this is, you're not expected to even necessarily know who all the agencies are that serve my community or what AAA covers what county. But My Options will do that for you. It basically answers those questions and makes sure that the people will get to the right folks. And these are trained, unbiased, again, person-centered individuals who are going to help meet the needs of those individuals. I'm curious if people have heard of My Options or the concept of a no wrong door. Of course, I can't see, not too many people are on camera, but seeing a few nods or shakes that this is something that's new to you. So if you take anything away from this presentation today, A, that there's a network that exists, and B, that this is the phone number. It's really the only number you need to know, and it'll get people connected to, again, the variety that we have, both AAAs, we have Centers for Independent Living. They often go by an organization called Disability Network, Capital Area, Disability Network, Lakeshore, etc. But you don't need to know that. You don't need to remember where those agencies are or what their names are. You can call this number. So speaking of partners and resources, again, our My Options, our options counselors are knowledgeable about these programs and services. They can help individuals make those connections. But if someone does know who their AAA is, they can certainly call that AAA directly. And again, that information and assistance is going to be made available. Some of the resources that we don't often think of that can be helpful to an older adult as they're aging: assistive technology. Sometimes it's called adaptive equipment or enabling technology, different, that might be a physical device or it might just be a tool or a resource that helps them navigate life in a more effective way. I mentioned the financial support, not only the funding that might come from an Older Americans Act program. Many of our states or communities across the state have what are called senior millages or elder person millages, which fortunately recognizes that as we age, our needs might be different or varied. And so that is a funding stream that's available in some communities. But there's also the need for greater financial support. Again, might be that utility assistance, rental assistance, transportation assistance, et cetera. So the AAA isn't going to always be the one source of funding for those needs, but they are part of that hub, part of that social service network. Equipment and supplies. There are loan closets for individuals. Maybe it may be a short-term need. Maybe it's a shower chair they need or a walker following surgery, or maybe it is something they might need for a longer term or indefinitely. But there are loan closets and or funding that's available to help make that support available to that older adult. And then again, we've talked about referrals and information. So just quickly, because I do want to leave a little bit of time for some questions. Here are some websites, some information about some of those sources of the Home and Community-Based Services, the AAA Association, the PACE Association. There's our MDHHS website, and I'm happy to make these slides available. We didn't talk about that in advance, Amanda, but I'm happy to send those out to you if you're in a position to share those. I mentioned the Centers for Independent Living or the Disability Networks. Home Help is a county-based organization. Many of the home and community-based services I mentioned, they all have a level of care assessment. Some require what would be considered a nursing facility level of care need, meaning they are eligible for nursing facility care, but want to receive that care at home, so they would need that level of care determination. But programs like Home Help do not require that same level of care determination. There does need to be an assessment. There does need to be a documented medical need or need for assistance with those activities of daily living, but it is not something that rises to that same level of care. Michigan Disability Rights Coalition is an organization that serves all ages. They actually run the Michigan Assistive Technology Program for the state of Michigan. So again, some of those adaptive equipment, those tools and resources. They have a loaner program, meaning you want to explore. You're not sure. You don't want to make a huge investment in something and find out it's not going to meet your need or it's not working the way you think it does. So MDRC can actually help connect you with like sort of tester loaner equipment to make sure that it is going to meet your need. And then Michigan Rehabilitation Services tends to be for younger adults, but they have programs for individuals with disabilities who want to enter or re-enter the workforce, because that's another important component of staying independent and healthy. And quite honestly, we didn't talk a lot about demographics, but or some of the data we're seeing, but more and more older adults are staying in the workforce longer or returning back into the workforce, at least on a part-time basis. And some of that, quite frankly, is just because of cost of living and their need for additional supplemental income. So there we go. Questions that anybody might have for me. I threw a lot out at you, I realize.
I don't have a question, more just a comment. I appreciated the fact that you did the regional listening sessions throughout, just because it's a one size fits all approach doesn't work, period, especially when you get into some of these rural communities. So that was one. And then you touched on it a little bit later. The biggest issue that we see, we have a 104 bed long-term care facility here in Kalkaska. One of our biggest issues is individuals being financially prepared for long-term care. The need is there, but they haven't done a lot of the financial planning to prepare to have a payer source for that to happen. Then there's a lot of family dynamics and everything else. So, but once you went in that last couple slides, you kind of touched on that a little bit through the different programs that are available. But yeah, that seems to be one of our biggest issues is the need is there, but getting all those pieces to line up can be really challenging.
Yep. And that's another example under the elder rights, not necessarily financial planning, but that's kind of can be a piece of it, right? Is knowing what are you going to need. There's some data, and actually a great partner. If you're familiar, the University of Michigan has the National Poll on Healthy Aging, and they've also, through the Michigan Health Endowment Fund, have been able to do some oversampling in Michigan to get some very specific Michigan data. And again, those of us who do this work, it's not a surprise, but as you said, people are not prepared or they mistakenly think that Medicare covers things that it doesn't cover, which it doesn't cover long-term care primarily, right? It doesn't even cover full healthcare in some cases. Like a lot of us grew up thinking, hey, when I turn 65, I'm eligible for Medicare. Great, I've got this healthcare coverage that's going to be available to me, and it's just not quite that easy. That's why the SHIP program, giving another little commercial for that, is so important because a lot of the enrollment, if not all of the enrollment now is online, which is not something that our older adult population is fully comfortable with all the time. It's, we don't want to overgeneralize, but in this case, it's pretty accurate to say there are large percentages of the population that don't want to have to go online for everything. There's still very much a pen and paper population. I'm not even eligible yet, and I'm still a paper and pen kind of person myself sometimes. So again, even if you were to send people to the My Options line just for that Medicare navigation, it's not just during open enrollment. They're available year round to answer questions, to better understand when those windows are, when you can or can't make changes to your plans. But yeah, so again, understanding the financial pieces is something that is an important piece of the puzzle that not enough people start to think of. And quite honestly, no one can really predict how much that care truly costs until
Oh
you're
yeah,
in, until you need it. And that's
yeah.
again something we're trying to do. Get people to start talk early, talk often concept, right?
Yeah, no, I agree. I think, and that's when I say one size doesn't fit all, that part does one size kind of fit all because the cost is pretty, equitable throughout the state. What we're seeing, we have an attached hospital to our long-term care, so we're seeing a lot of individuals that approach the emergency department, and it's like a full-blown crisis. And then we're
Mm,
trying to figure out like how do we do a safe discharge plan, and how do we get this? And obviously long-term cares don't have this, they don't have like EMTALA rules like they do in emergency department. So you get a lot of long-term cares that are like, hey, we're not taking that patient. Like they don't have a payer source. And then so you just start this downstream, like it's a long process and it's so much easier to admit people into a long-term care from their home setting than it is from the crisis of an emergency department. And so we're trying to get that word out, but and I appreciate your messaging and everything you guys are putting together here because I think it's a problem that's only going to exacerbate into the near future. It causes backups in hospitals, but post-pandemic, there was kind of this lull where everyone was like, "Oh, I'm gonna avoid it. We'll change our lifestyle and keep X, Y, and Z at home." And then what is happening is, the infrastructure in those people's homes has gotten to the point where they're not able to care for those people, and then it just starts like a whole cycle. So I appreciate that the fact that the conversation and all these initiatives are being put in place now because I do feel like we probably are going to have a potential issue here in the next couple of years.
Tammy,
Yeah,
would
that's
you
one of those hard parts of, we want to celebrate aging, but there are realities to the fact that we are an aging society.
Tammy, I did just want to ask, so, and I might have missed it at the beginning. So you talked about the key themes that came out of those focus groups. Now, what is the next step from those?
So the next step is, thank you. Happy to revisit that. So we have our goals and objectives. We did engage our area agencies on aging and the Title VI grantees, the tribal partners, in the development of our goals, and to a certain extent, our objectives and strategies, so that we're in alignment. There were no surprises. People feel like they have a role in supporting the state plan on aging. Now, technically, it is a document that speaks to and is relevant specifically to the state unit on aging, so my office. But in terms of developing partnerships, in terms of increasing access, it's a collaborative effort. We need our partners to understand and recognize that. So we'll be going out to public comment with the draft plan. The plan will include sort of the narrative of the plan will include some of the context that I shared with you, some of those key themes, describing the needs assessment process, and it will include our proposed goals, objectives, and strategies. So we'll have a 30-day public comment period that'll happen kind of middle of next month. And then it does go to our Commission on Services to the Aging for formal approval. And then ultimately ACL will have to approve and give us the thumbs up or the green light or the stamp of approval for them. So yeah, we're kind of in that, we're in the sort of more the internal tweaking of language kind of stage. It'll go out to public comment. Welcome your assistance, in fact, in terms of you, as I mentioned, your network, you are connecting with older adults. You are a contact point for this constituency, and you're a trusted and important touch point for this population. So any support and assistance you have in maybe talking about the fact that there is a state plan on aging and that there is an aging network, that's all welcome. But you all as individual stakeholders are also welcome to take a look at that. And so we'll be sharing it out. There'll be a press release. So if any of you are on the MDHHS, communication, through the NeoGov, you'll get that press release, but we'll put it out through different partners, and hopefully you'll see it and have the opportunity to react and respond to it.
Great, thank you. Tammy, is there documents that we can attach or that I can send to the group here on the My Options? Is it just built within the MDHHS website, like a flyer?
Yeah, on that website, and I can put that URL into. It's kind of a long one. Probably easier if I just send you. We have a one-page flyer that I'm happy to send to you and have you distribute that out. That would be very welcome.
Okay, perfect. Thank you.
Yeah, thank you.
Any other questions? We are right at the 1 o'clock top of the hour, so just want to give you all an opportunity if you have any other questions. Tammy, thank you so much for coming today and speaking about the state plan on aging. We really appreciate your partnership.
And I appreciate this opportunity. Thanks so much for your interest and your attention.
Yeah,
Hope
thank
it was
you so
helpful.
much. Have a great day, everybody.